Everyone. Let's get started. I am thrilled to have us this is our final panel in the Innovations in Food as Medicine Summit series that we have here at Prime Health. We have four exceptional panelists today and one amazing moderator who's going to walk us through the discussion they are having today. So to start, excited to have Glasha Marcombe from Health Begins serve as our moderator today. Glasha, I'll have you introduce yourself, give folks a little bit of an understanding of what your experience and expertise in this topic is, and then get the conversation moving. Before we get there, if you all have any questions or anything you might want to hear the panelists talk about, please put them in the chat. We do have quite an agenda planned for you today, so we may not get to all the questions, but we'll be monitoring them and ensuring that we cover as much as we can during today. For all the sessions that we've had up to this point, those recordings have been available to all the people who are registered and will be available on our website after the panel today, most likely sometime tomorrow. We're working on that. Again, any questions in the chat, and I'll pass it to you, Glasha.
Thank you, Sarah, and thanks everyone for joining. Really excited for this conversation. So my name is Glasha Marcone. I'm the VP of Learning and Innovation at Health Begins. Health Begins is a consulting firm that works with Medicaid serving organizations on upstream solutions. And we have a wealth and breadth of experience working in food as medicine. We were one of the co-creators of the Medicaid Food Security Network, as well as facilitators and designers of several nationwide learning collaboratives and action networks related to food as medicine. So I have colleagues that are way deeper in the work, always happy to connect you them. But for this panel, we really want to focus on the folks you see in front of you. So today we're going to be talking about sustaining innovations in food as medicine, and I'm really excited to be joined by these expert panelists. So we have Rich Malloy, who's a managing partner at Springtime Ventures and host of this VC Minute podcast. We have Joe Babarski, who is the director of the Not Impossible Institute, excuse me, who empowers change makers and teaches the creation of possibilities as a practice. We have Adam Dole, who's the co-founder and COO of Bento and has a number of previous roles that he'll kind of incorporate into this discussion. And Mireya Chavez, who is the program manager at the Colorado Access Foundation and has over 12 years of experience in this sector in space. So rather than me kind of going into each person's bio and experience, I'd love to hear from each of you. So to start us off, can you give a quick overview of your organization, why you got engaged in food as medicine, and if you have any hot takes you want to share to kind of spice up the chat, you can feel free to do that. So we'll start with Mireya.
Thank you, Glasha. It's a pleasure to be here, and I'm excited for today's conversation, and I will definitely try to drop some gems as far as like innovation. But with that, I'm with Colorado Access Foundation. We were established in the fall of 2021 to advance health equity using a long-term focus and a strategic approach. The foundation was officially set up through Colorado Access, and I won't go too much into the details of the difference between those, but they are our sole funder. But our work focuses on communities experiencing the greatest inequities due to income, race, ethnicity, age, and geography, including those that are eligible for or enrolled in Health First Colorado, which is Colorado's Medicaid program, or the Child Health Plan Plus, CHP Plus. And we invest in work that advances health equity for Coloradans of color, and the LGBTQ plus community, immigrants and refugees, newcomers. And essentially our focus, though, is really on two areas, which is building a more diverse healthcare workforce, but also improving key conditions that affect health. And what we've realized throughout that, specifically to the improving key conditions that affect health, is, when it comes to people taking care of their bodies, 20% of health outcomes are influenced by the clinical aspect of it. And then the remainder is really all about what person people are doing on the external sides of things. So again, where you live, where you eat, where we eat, live, pray, and we love folks, it really has a lot to do also at impacting the health outcomes. And again, the extent to where your life is thriving. And I got involved in this work to help connect those pieces again. The world definitely goes round, and as does the body. And so what you expose yourself to is really, again, something that has to be further explored, because we just, again, your zip code matters, but also, again, what you're consuming. And when it comes to those two things, and here's where it gets controversial, right, is, I'm eating junk food, not because I want to, but that's all I have access to according to my zip code, right? So again, Cheetos is on the menu for tonight, regardless of whatever dyes they have in there. That's what I can eat. And so some of the times these choices are made based off of those circumstances, not so much, again, because I'm unaware or out of touch with what I should be eating. It's just what I can consume and have access to.
Thank you, Medea. Rich, do you want to go next?
Sure. Hi, everybody. My name is Rich Malloy. I'm managing partner of Springtime Ventures. We're a seed stage fund based in Colorado, Austin, and Atlanta. And we're investing out of our second fund, and we dialed in our focus areas for this fund to be fintech and insurtech, logistics and supply chain, and healthcare. So healthcare, food as medicine, I think certainly crosses over into the healthcare category. And the reason that I am on the panel, I think, is because I mentioned to an advisor for the Prime Health Conference that as a firm, we believe that food as medicine is not a venture backable category. And he said, "Oh, well, do you want to be on a panel?" And so here I am. And I will say that I do believe that food is medicine, and we practice that at home. And but as from a venture model perspective, we struggle with it as a team, and I've passed on food as medicine businesses simply because of the challenges that we have. So I'll leave that there, and we can come back around to it as you all throw rocks at me. No, I'm just kidding.
Thank you so much, Rich. Adam, love to hear from you.
Thanks so much for including me on this panel. Adam Dole, co-founder of Bento. We are a patient engagement solution that uses food to engage people in the management of their health and healthcare outcomes. Part of the thesis and hypothesis that we've created Bento around is the concept that there is more than enough food in our country to feed everybody in a way that is not just curated for people's disease risk factors, done in a really convenient way that meets individuals in the community where they are, but does so in a stigma-free way that doesn't ask individuals to set their dignity aside to participate in the health that can be derived from using food as medicine. But more importantly, the way we see connecting the dots here is using food to engage people that have potentially been disconnected from their healthcare and healthcare system, maybe for years, if not more, living with disease risk factors that are going to show up in the emergency department and create high cost episodes of care that not only touch those that are paying for healthcare in our country, but ultimately impact people's quality of life and ability to live the life that they deserve. And so at Bento, we really believe in the ability to connect all of these dots. We have more than enough food in our country to feed everybody. And we built a platform that can tap into grocers around the country that allow our team of registered dietitians to be able to curate those grocery orders on behalf of individuals, disease risk factors, cultural preferences, any other logistical things that need to be considered to make sure that the right food shows up for the right people in a way that builds trust and engagement. And then we layer on care navigation capabilities to be able to help people now who maybe weren't in the best position to engage in their health and healthcare, to make sure that they're engaging with their primary care, make sure that they're participating in disease management, and ultimately getting outcomes that can justify the cost of the food and justify the cost of using world's leading technologists and company resources to see the kind of outcomes that we believe are possible, which also makes us venture backable, which Rich, I'm excited to talk more about this on this panel.
Thank you so much, Adam. And Joe, please introduce yourself.
Thank you, Klasha. And I'm very glad Adam went before me, and maybe that'll make sense in a moment. But I lead the Not Impossible Institute, which is part of Not Impossible Labs. We're based in Venice Beach, California. We're a futures lab that's committed to confronting absurdities, things that feel like they just shouldn't be, and really that drive lack of access or opportunity for individuals, families, and communities. And that work has been really project based for 10 to 15 years. Innovation work, incubating technology, hardware, software, but also wrapping storytelling into that process, not just as marketing at the end, but actually deeply engaging and understanding. And there's a reason we have documentarians on our team next to technologists, next to public health experts, really integrating an understanding of people's stories into every step of the process. So we see food insecurity, lack of access to food that nourishes and drives people's health, as an example of a lack of dignity and care. And those are all core absurdities facing individuals and families every day, but facing us as a nation when you look at the costs and health outcomes, considering what we spend on healthcare. So we see food as identity, connection, and fundamental to health. That really actually started from a place of sort of dignity of access, because Bento, that Adam leads, began as a little effort that was incubated at Not Impossible Labs that was really not yet food as medicine, but about a hunger and food insecurity intervention, and just thinking about how to reach people in the most simple way with a text message based platform, top up access to meals that someone could place an order. We would curate options for them. They could place it using an alphanumeric input on their phone, walk in and pick up a meal at a restaurant that was close to them. Again, needed to be something that met people where they are, whether they were dealing with housing insecurity as well, whether they were working multiple jobs, which is often the case. So that little intervention that was more of a philanthropic effort was the R&D process that took quite a lot, quite a significant amount of time, but that led to the R&D that had given rise to Bento as something very different, but it began with an idea. It began with gift cards and Google Voice numbers and kind of hacking together how to do this. So to me, I think that I recognize, maybe this is my spicy bit, is that R&D is maybe in so many ways and so often not venture backable, but it's responsible for tremendous human advancement. So how do we approach that R&D of food as medicine in a way that I'm excited to talk with this panel about, incubating new possibilities and new ideas, and scaling the ones that work. So I guess I would just want to wrap with recognizing that we all need food to survive and thrive in this world. That's one of the very few things that we all have in common as humans. And it is the front door to any other possibility that someone wants to make true for an individual, your family, or a community. So I'm excited to dig in.
Thanks so much, Joe. Thanks all for sharing with us where you're coming from. So putting on our professional cap, so the roles that we have at work, the question I have is, what does impact and sustainability mean to you? And how does that translate into the dimensions of value you prioritize when deciding on whether a food as medicine innovation is worth investing in or sustaining? And as a kind of side question, how long are you willing to wait to see meaningful impact from food as medicine programs? We know there's, indicators and outputs and outcomes and impact. And so how do you kind of think about that continuum? So we'll start with Rich here, and then go to Adam, Joe, and then Medea.
So, I think that if I were to, maybe clarify, where, sort of the what I dropped here at the very beginning, right? But when I think about, the topic of this, right, sustaining innovation, right? I want to be clear that venture capital is not a sustaining innovation model, right? Venture capital is a bet the house, return the fund model. And so, and so there are, I think, great businesses out there to be built that can sustain innovation, that can bring innovation and sustain innovation. Venture capital is, flashy and is in the news because but it also has led a significant amount of the technological advancements we've had in the last 30 years, arguably 50 years even. But you think about it from when I put my VC hat on, right? I have a $25 million fund. I evaluate every investment, or we as a team evaluate every investment based on can we return the entire fund from this one investment, right? And just to walk through the math on that, right? If we get 5% ownership up front, assume that we have 50% dilution over the long run, I need $1 billion valuation to pay back $25 million, right? 2.5%. Right. And so that really at 5x multiples on exit really comes down to a $200,000 a year annual revenue business. And I'm sorry, my son is homesick. My wife is at the doctor's and he's freaking out right now.
All good. We
Okay,
can,
buddy, you go
we
watch
can-
number blocks. I'll be out in 1 minute.
please feel free to step away if you need to.
I'm going to
no
pause
worries.
there and get him settled.
Thanks so much, Rich. This is life, so we appreciate the honesty, and of course, we're all giving you some grace. So we'll go to Adam next. Again, the question is, what does impact and sustainability mean to you, and what are the dimensions of value you prioritize?
So I think about these two things in two buckets. When we think about impact, it really is defining the problem in a measurable way and holding us accountable to, are we making progress against the ultimate measure of that progress? And for us, we started, as Joe mentioned, by addressing what we believe to be a very preventable problem. Around 50 million people in our country are experiencing food insecurity. And when you start layering on top the additional at-risk community members, that number quickly goes to close to 100 million people in our country that are at risk of not just experiencing food insecurity and housing insecurity and many of the other upstream risk factors that we know contribute to a lot of downstream chronic conditions. But you start looking at a lot of the reasons why people aren't in a position to manage those disease risk factors. And that total addressable market is huge. And so we put that number at the denominator and hold ourselves accountable for, are we improving the disease risk factors of that number of people? And, are we moving toward our mission of eliminating these types of very preventable diseases? We're talking about type 2 diabetes, hypertension, heart disease. Not only do they have a nutrition component where food is an active ingredient to improvement, but the lack of food is going to prevent somebody from engaging in the appropriate disease management. And so when we first started, we weren't quite sure how to talk about bento because we didn't fit nicely into one bucket. We didn't fit nicely into a medically tailored meal bucket. We didn't feel nicely into a care navigation bucket. And the reality is, we blur these buckets and we integrate all of these things to ultimately achieve the outcome and the impact that we're holding ourselves accountable for. The sustainability piece is the second bucket, which is, do we have a business model that aligns the outcomes with the ability to continue to grow? And that's where, with a total addressable market size of 100 million people in our country that are experiencing various risk factors that we're able to address, our country spends way too much money treating the downstream consequences of those things. And so our ability to get somebody engaged who's been disconnected from their healthcare potentially for years and actually build the engagement and trust needed to improve those outcomes puts us in a really unique spot. When we have conversations with health plans that are in the position to reimburse for these types of outcomes and services, we might ask them when the last time their members proactively reached out to them to let them know that their contact information had changed. And no surprise, it's crickets. And try to drive engagement around somebody's disease risk factors with somebody that you don't even know how to reach out to and communicate with in a trusted way. So we've solved those problems, and we've actually figured out how to get people who've been disconnected really engaged. And so our ability to return from an ROI perspective on the quality of people's lives just so happens to have aligned incentives with the financial situation that our country's in related to funding healthcare. And it puts us in a really unique position to not just return our investors' funds, but ultimately solve the outcome and the impact part of the equation, which is how many people have we improved the quality of life for and have taken them from a state of being food insecure to at risk of lots of chronic conditions to better health, and ultimately getting them out of a state of poverty so that we can graduate people off of needing bento and ultimately graduate people off of needing government subsidies because they're more self-sufficient, independent, and able to truly live the life that they deserve. And that's
Adam,
how we
can I ask you, how do you do the behavior change? Because this is the biggest hangup that we've had is, yes, food is medicine, and we all believe this, right? But behavior change, it's easy to believe that food is medicine in the Front Range of Colorado, right? Where, we live in this beautiful bubble, right? But how do you deliver behavior change?
It starts by providing immediate value to somebody who needs a very specific thing. If you're taking, an at-risk community member that is unclear where their food's going to be coming from, that day, that week, that month, and you give them the thing that they most need and benefit from in a way that is convenient and stigma-free, that introduces and opens the door. It doesn't lead to the changes, but it gives us an opportunity to then establish that trust, and trust and consistency then earn us the ability to start making inroads and understanding what's preventing somebody from engaging. And so that behavior change isn't going to happen overnight. It's a number of small steps that are architected very intentionally by making sure that we are addressing the human need first, giving people access to groceries from their local grocery store turns out is a major catalyst to giving us that entry point. But then how we communicate, how we show up every week, week in and week out, that consistency truly is not just a trust builder and allows us to start making those behavior changes with those community members over time. And the biggest behavior change is making sure somebody's been to their primary care doctor. That might actually move the needle more in a short amount of time than the longer time needed to influence somebody's diet, which is happening, but that might take 6, 12, 18 months to really show benefit. Where if somebody's not been to their PCP in over 12 months or a lot longer, that might be the first step to a whole slew of behavior changes that we're going to be able to work with that person on over a period of time. And it all started from the food, but it's not food that's been donated, that's likely to expire, that's been pre-frozen. This is food that we all have the ability to shop for when we're going to the grocery store. We want to make that experience available to everybody, no matter what their socioeconomic status is. And it just so happens that, as I mentioned, is a great catalyst to start that conversation and engage those individuals on a level that means something to them.
Thanks so much, Adam. And thanks for the question, Rich. Love the direct conversation. So I'm going to hand it over to Joe to answer the question, then Medea, and we'll keep going.
And I'm gonna try to keep it quick because this stuff is really exciting to dig into. But there's I just kind of want to, I think, build as opposed to provide some alternate parallel idea of impact and sustainability. But I think that Adam also hit on something, and something that I've heard from a lot of on these panels throughout this summit, a lot of different people representing a lot of different sizes of organizations, serving lots of different types of constituents and audiences. And there is something that I feel like is critical to both the impact and sustainability, and it doesn't clearly fit into operational efficiency and efficacy, but it's the connective labor that is part of the process. And I think that I know firsthand that bento, and it was back when it was called Hunger Not Impossible, there was not just an assumption, there was a commitment to someone being there, where maybe when someone was having a challenge and they couldn't pick up a meal, they're having an issue, that they can call and talk to someone who was thoughtfully engaged and recognized the importance of that person being able to eat that day, or that person dealing with a challenge that they needed support around. So I do think that there is, this is my recognition. Yes, it needs to be fundable and it needs to be profitable, but also I think that it needs to drive a meaningful change for a person in their life. And that sustainability, I think, comes from emotional ownership on both sides of the equation. And I think that that is an interesting challenge, because this is no surprise to anyone on this call, that our trust in institutions, systems, companies we've become detached from a sense that they really care about us. I think a lot of people, I should say, feel really detached from the idea that they care about us as individuals. So I think that if this becomes something people will fight for, both fight to receive, but also fight to provide, I think that is critical. And I think there is as much mindset shift needed as there are sort of deployment of operational tactics. And so we have to figure out how to marry those two things.
Thanks, Joe. And Medea, would love your perspective here.
Yeah, I'm gonna definitely build off of what everyone just said, and this probably may sound like it's gonna solve all the world's problems, but it really does come down to the strategy needs. Well, let me first back up really quick and kind of share a little bit how we see the impact. A signal of progress that we're aiming to when the ultimate community outcome that we want is that more individuals have access to affordable, nutritious food. And so signals of progress that we see in that space would be increased access to healthy and nutritious food that's culturally relevant food, increased participation in food assistance programs as needed, improved integration of convenient and sustainable solutions that expand local food systems, programs, and services. And so that kind of just builds on what Adam and Rich and Joe, like everybody kind of just touched on. And so, it does begin again, that clinical aspect of it in order for everyone to get what they want. And so again, it's probably fitting with what's going on in today's world, particularly when it comes to healthcare, and access to healthcare. So we really need to focus on primary and preventive care, and food can help address some of those things. And so we can catch disease early, we can prevent them, or we can offset them, delay them from happening, which leads to lower cost and better outcomes overall, financially, economically, as far as the life sustainability for folks on that end. And then obviously payment reform, again, we should be paying for help, not for procedures. And so having smarter spending and better incentivize not just the individual, and it kind of comes back to that behavior change, Rich, right? What is that carrot, if you will, no pun intended on this one, for folks to get on that, and then, simplify the coverage. We're just right now, we need to reduce that churn and confusion, but stabilize enrollment into these healthcare folks, because the healthier people, the healthier folks that are enrolled into insurance, the cheaper it makes it for all of us. Again, your health matters to me because it also impacts me at the end of the day. And so again, this is why we should be caring, and people think of it as a social network, but regardless whether there was Medicaid in this world, your sneeze can still counteract something inside my immune system. So regardless of insurance status, again, it impacts me. And so that's where we come down to, really investing in social determinants of health. How can we treat these root causes of poor health? And it does come back down to healthcare access, food access. What are we having access to? And then, so it just leads to, again, fewer high cost crisis moments in all aspects, from housing, food, transportation, education, childcare. And so that's really the gamut. And it ultimately does impact one's mental health. And so how are we integrating that, again, in all these psychological things that are not being addressed? And so just one thing, again, how is that impact happening? And we shouldn't always be really wanting to stop and just wanting to test what's the new and shiny thing, but we also shouldn't just go with what's traditional, right? And so there's plenty of things that they don't always have to be proven, because it's not a one size fits all approach. And so, the way we come from it is just really continuing to support and refine these proven interventions. But in addition to that, we want to allocate resources that pilot and test innovative approaches. And developing those mechanisms that allow us to really assess quickly, but also integrate some of these successful models, such as like that care navigation, those community health workers and folks helping people get back into the healthcare system, and empowering folks into, saying, hey, I need this, I need to advocate for it. How can we bring a grocery store into our neighborhood? How can we bring these things to our neighborhood that has been underinvested or disinvested from? And ultimately, it just leads to better health outcomes, better situation for everyone. And so with that, I'll stop.
Thanks, Medea. I am going, just for the panelists, I'm going to go a little bit out of order here, because I think there's a natural place this is going that I would really love to touch on now. So we find ourselves in a really interesting, challenging time right now when it comes to healthcare and food as medicine. On one hand, there is kind of unprecedented risks and attacks on Medicaid, on SNAP, WIC, these kind of social safety nets that ensure that we can kind of systemically address social determinants of health and root causes and upstream sources of disease and illness, and kind of some more support and promote, equitable, culturally appropriate services that address these needs. And at the same time, there is kind of this momentum around food as medicine. And so I'm curious how you're kind of seeing the moment. What opportunities or potential pitfalls should we be paying attention to right now? Where is kind of their hype that is earned? Where is there areas that are really being overlooked? Would just really love your perspectives here. And I'll start with Joe.
Oh, goodness. Okay, so part of I can't help but bring to this sort of my background. I'll admit, not so much in health. I guess I realized later in my career that it was innovation work, but I worked in the startup space around really inventing social media strategy when that wasn't even a term that people used and were familiar with. And later went to Disney and really was focused on data and insights driven storytelling. And there was something we used to say, which has really let's just say come back, I think, in ways I didn't realize at the time. But we used to say authenticity is the new barometer of quality. Now it's not how highly produced it is, how much funding went into it. It's how authentically it is communicated and comes across. And I think we all are now realizing we're living in a world where it doesn't even, maybe the facts behind it aren't as much playing into how it's received as opposed to how authentic it comes across. So I think that there's a reason that sort of storytelling and that as a focus has brought me to the place of being on this panel, because I think the way we tell the stories, who tells the stories, and how the stories are told is incredibly transformative. And that is deeply concerning, that maybe there are some people that feel too many of us deeply untrustworthy who are actually telling a story that is something we might be able to agree with in many ways. And how do we recognize that? How do we figure out how to tell the story in a way that isn't just responding and actually sometimes a counterpoint that isn't serving people ultimately? But that to me is the sort of power of narrative, is what we have to really take on, look to the ways that we drive and control narrative, and make sure that we don't just respond to narratives that gets us to a place where we're telling a story about food as medicine that is chasing a direction that isn't serving people, but actually telling a powerful parallel story that people can connect with. Because then you're ultimately going to have to meet people where they are. People are, and we have to recognize some people are going to connect with a story told in a way, told by a person that might be very different from my point of view and might not be something I agree with. So I think I happen to live in Washington, D.C. I have a spouse who works on Capitol Hill. There is a lot of perspective that is hard to swallow. But there is a quiet power in the place where the incentives overlap and where people believe in the same thing. And I think the narrative that we are all experiencing does not exist very often in that overlap powerfully. So I think figuring out how to dream, develop, and deploy, that's what we say, the narratives that can exist in that overlap of incentive that really encompasses all ships rising together. To me, that is where we have to put our focus, because it can be so distracting right now to put our attention outside of that area.
Thanks, Joe. Mireya, I see you doing a lot of head nodding. Would love for you to kind of share what you're thinking here.
Oh yes, very passionate. I'm gonna get on my soapbox. There's 5 things. Cultural sensitivity. Again, what Joe said, recognize that food is deeply personal and cultural. And so we need to avoid a one-size-fits-all approach. to nutrition and health. And then we also have to take that holistic perspective. Food isn't just about the clinical nutrition, but it's also about an emotional and cultural significance. So, it feeds the soul. And so, I should be able to treat myself with a pie and cake, because it feeds my soul. It makes me feel good at the end of the day. A tub of Ben and Jerry's ice cream, Rocky Road, just in case, And so it's just those things that, again, it doesn't fit perfectly to meet nutritional standards, but it makes me feel good at the end of the day. And then we also need to, this is something, again, happening right now, we need to avoid medicalization, because we have to be cautious about overly clinicalizing food as well. I don't want to say I'm only eating this apple because my doctor prescribed it to me because I have diabetes. I don't want to have diabetes. So how can we stop from getting diabetes in the first place, or at least, again, delay it because of, again, those external factors. And then, it's, again, we shouldn't be, we can prescribe food, but at the same time, again, feeding the soul, to get it being preventive in that aspect. And then there's that individual context as to what has been said, that story, really understanding the definitions of healthy. It's going to vary. So what looks healthy to one person might not be appropriate for another. And so considering these factors like body type, cultural background, personal experience is just something that, really needs to also be emphasized. But also coming back to the engagement strategy. And Adam talked a little bit about this as well, is using food as a bridge to healthcare. Not just a prescription. And so, the goal is to really re-engage people and empower them with the tools and letting them know that, not only do you need health insurance and visit your doctor, but you also need to be able to take care of yourself with these things that we have access to. We have our systems set up, whether that be the SNAP program, you have your Medicaid, and there's all these social safety net programming, and they're there for a reason, for people to use them as needed, right? And then you hit that benefits cliff where you are thriving in life. And so right now the concept is that in order for you to have health insurance, affordable health insurance, or to be on the SNAPs program, you have to make this certain threshold of income. Right? You have to live this type of quality of life in order to have access to these things. And that should not be the case. Again, it is too based off of capitalism and economics and all that stuff. And so it's like, well, why should I get off Section 8? Why should I? Because I'm going to lose all these benefits, because they don't have an opportunity to thrive once they're off of these social safety nets. So there's no encatchment within the middle. And so that's where the emphasis is, again, of like, who's thriving, who's not thriving, who's winning. And it's just a lose-lose situation when we start thinking about that. Again, it comes back down to, Glasha, if you're sneezing on me, that's not a good thing. It's like, it's allergies, or you got a cold. I'm concerned, but your health matters to me for a multitude of reasons, not just because you're impacting me, but again, and you could just very well have that cure for cancer or something within your blood that I'm just like, let's do it. But if you're not engaged with the healthcare system, or engaged in, the food system as well, we're missing opportunities there.
Thanks, Vidya. I don't have the cure for cancer, but I could probably bake you some good cookies. Um, so just to kind of build off of that, I think, Rich, I can imagine that with a national focus, there are a lot more startups popping up, or will be popping up, focused on this. And so I know that you're not currently investing in food as medicine startups, but I'm kind of curious about your take on what's happening nationally, and the opportunities and pitfalls, and just like what you would say to some of these startups.
Yes, and first I want to say that medicalizing food, I'd never thought about that, and that's a really interesting thing to say about how it almost vilifies it, right? And that's a great perspective. I'm gonna sit with that for a while and think about how that impacts some of the stuff that we're seeing out there in the market. From a, as we talk about the current administration and the changes and things, I always say that volatility is venomous to growth, and so stability is when growth can really thrive. I'm a growth investor, right? And so this is where my head is at. The other thing that I think about is risk versus uncertainty. And so I'm in the business of making risky investments. But if but if I'm uncertain what the risks are, there's too many unknown unknowns for me, right? Or if I'm uncertain about what the macro environment is, then I'm going to hold off. And so this is, I think, as you think about where businesses that are relying on payments from the government, and those are in question, any business, regardless of whether you're taking venture capital, trying to pitch venture capital, or just building a business, right? You need to be thinking about, where am I getting revenue from? How can I expand my revenue sources? How can I expand my revenue streams? And so thinking about the ways that your business can be sustainable so that you can continue to sustain the healthy innovation that you're building. And so the emphasis really for founders always should be on building sustainable businesses. And when you have revenue and you have growing revenue, then you have a story to tell if you want to raise venture, or even if you just want to go to the bank and get a loan or get a revenue-based investment or do something other than venture capital. Get customers, get revenue, and because you are in the business for serving those people and not for serving investors.
Thanks, Rich. And luckily we have a founder here. So curious, Adam, how you're experiencing the moment and, the opportunities and pitfalls you kind of are seeing for Bento, but, anything you'd offer for others as well.
Yeah, I think regardless of which administration is in office, the reality is that, like, the food as medicine space is still very early. There isn't a strong understanding of how to use food as a health benefit yet to achieve the optimal outcome. Because the optimal outcome for different subpopulations is going to require different dose and duration of the intervention. And if we're using food as a core part of that intervention, even if it's just to establish a trusted relationship and then layer on a bunch of other care navigation and disease management programs, we need to hold ourselves as an industry accountable to measuring what works, how to adjust, and essentially titrate the intervention to see the kind of outcomes that we need to. And also, kind of regardless of which administration is in office, payers of healthcare are always looking for better ways to achieve better healthcare outcomes in a cost-effective way, whatever that needs to look like for them. And so both of those two things existed for not just us as a startup in the previous administration, which helped us chart a path, but now clearly exists, with the current administration, looking for more cost-effective solutions that can do right by taxpayers. And so while I agree with Rich, we've got to be aware of diversity in our revenue streams, keeping focus on the outcomes that matter, ultimately trying to drive better health in a cost-effective way, that's going to persist regardless of which administration is in office. And so without making this about the uncertainty of how some of these policies are going to shake out, we're pretty certain that our healthcare system wasn't great before, and we have an opportunity to make it better regardless by doing right by patients and ultimately holding ourselves accountable to a sustainable business model that demonstrates that the outcomes are worth the inputs. And that's something, whether we're using food or care navigation, for us, it's all integrated into making sure that we're seeing those kind of outcomes. And we believe that we will be in a unique situation, and we found ourselves in a really unique situation where we kind of trade on the currency of trust. And when you have that trust, you can really steer individuals to the right care at the right time. And that should be politically agnostic. That should be administration agnostic. And ultimately, doing it with convenience and dignity as core design principles is just kind of continue to be something that we focus on. And I couldn't agree more with the medicalizing of food. What a way to frame, what we should be staying away from, because food is intrinsically tied to culture. And not only should you not separate those two things, we should be diving straight at the ability to leverage food and tie it to culture even more so that people can participate in ways that are comfortable for them. And it's the best point of entry, as has been talked about, if from everybody, I think on this call, to be able to establish meeting people where they are in a way. Everybody has to eat. Food's intrinsically social. If it's done well, it can be fun and actually healthy as well. But that's almost like the least important part of the use of food, and that's what makes this such an interesting topic and such an interest, and probably why food as medicine has gotten a lot of attention. But I'd like to see less use of the term food as medicine and more use of the term food as fill in the blank, food as building trust, food as engaging, food as meeting people where they are, and how we take that relationship with that member from there is going to be dependent on what the company does. But food can be a big lever for change.
Thanks so much, Adam. I'm finding this really fascinating because, I've worked across federally qualified health centers as a navigator, like interfacing with people who are experiencing food insecurity at large healthcare companies who are looking for, vendors or startups to invest in or work with to deliver these services, as well as in healthcare startups who are trying to get those contracts and venture-backed startups. So I feel like this is like the internal conversation I have with myself, and I'm kind of wearing all these different hats. So I'm really appreciating this. To kind of move us forward, we're all approaching this from a different perspective and with different set of tools to address and approach this problem. And so for this question, kind of put on your different hats, or you can kind of talk about, personally versus with your, role that you have. But as we work to sustain innovations in food as medicine, how do you balance scaling proven interventions with investing or working on newer, less tested models that could, meet some of the emerging needs or fill in evidence gaps? And part of the reason I asked this question is that we have several folks in the audience who are participating in the hackathon. So, what problems can we offer to them? But also, how do you kind of just think about really doubling down on something that's proven versus testing something that's, newer? And I'll start with Rich on this one.
I was afraid you were going to start with me.
I know. I was like, you haven't gone first in a while, but I know that.
um, I just I find myself telling founders so often, right, that build for your customers, don't build for your investors, don't build for VCs, build for your customers, right? What do your customers want? What do they need? I mean, one of the challenges when your user is separated from your payer, there could be a disconnect there. And so being able to straddle that line and being able to manage that disconnect in a way that works for both parties, I think is very tricky. And so that's a difficult thing to balance as I think about the food as medicine, unless you had a B2B angle, right? For example, like we looked at a company here called BiteWell that I think is now called Food Source or Food Health. And they have a food score, like a single number, right? And I love that, right? And they sell to grocery stores now, and that you can pick up an RX bar and see it's got an 88, and pick up a Kind bar and see it's got a 35 score, right? So they've got a direct line between the person who is paying for it and the user, right? I think that's a more direct line. So think about those pieces and think about those aspects. Don't get sucked into this sort of what I call like the VC feedback death spiral, where it's like, okay, I've got this great idea and take it to a VC, and VC says, oh, your TAM's not big enough. Oh, okay. Well, what if we, did this a little bit? Oh, well, that's not a scalable business. It's not a SaaS business. Oh, okay. So you turn a little bit this way, like bring it back to the to the VCs and like, oh, well, some other VC bullshit, right? And before you know it, you're 180 degrees from where you started, and you're not serving your customer, right? You're serving somebody that, that you're trying to get money from, right? Go serve your customers, build a great business. And if you want to raise money, then those options will be available to you.
Thanks, Rich. That's a really good reminder that I think, given kind of the hype around venture capital, a lot of folks think that's like the way to get money and investment in their ventures. And there are a lot of different options. Can you, I don't know, maybe other folks can share too, but can you name some of the other ways that folks can get investment in their ventures?
Absolutely. And so so right now it's, the tools that are out there for bootstrapping are incredible, right? And so being able to no code, low code, vibe code is, it's really extraordinary what you can do with some of these tools, right? And so that can lower your barrier to creating an MVP and to creating a usable product that somebody can go out and build. The other thing is SBIRs, STTRs are a fantastic resource. Wow, gosh, how much? It's something like 4 billion a year goes through the SBIR program. And so some of them are revenue and some of them are grants. And there are 9 different departments of the US government that do these, and some are better than others. But the NIH, the National Institute for Health, and the NSF, the National Science Foundation, are 2 of the best. And interestingly enough, AFWorks, the innovation arm of Air Force, actually runs a really good general program, right? They have, they're basically a giant employer. The DoD is a giant employer, right? And the Air Force wants to keep their airmen healthy. And so they do programs. We actually had a fitness startup that won an SBIR right before they ended up exiting. And so those are all great sources of capital. And then the last is also, like, if you need to raise money and you really have to, raise from angels. Abby Mercado, who is a Techstars founder here in Colorado, she was on my podcast, The VC Minute. She raised from 60 angel investors for one of her rounds. Her business is Rescripted Health. It's in the reproductive health industry. 60 angel investors. I mean, my mouth fell open when she said that, but take five grand here. And she's like, look, these are people that, the angel investors were the most committed investors that she had, and was able to pull together what she needed and, nothing more really, to get her business to the next level.
Thanks so much, Rich. I want to go to Mireya next. So again, the question is, how do you balance scaling proven interventions or, investing more in existing grantees versus newer, less tested models? Would love to hear from you.
So I guess a key for us in our grant making is really the key is maintaining like a balance between the reliability and the innovation. And so always keeping the ultimate goal of maximizing positive impact for the community in mind, always. And so, when it comes to our grant portfolio, we have a multifaceted approach to all of what our grant partners are doing. We have like the Children's Hospital of Colorado. They have what is the Food as Medicine program, and they want to scale it. And the program to Adams County, which in Colorado is also a food desert and a community-based organization desert. And so their goal is, bringing children and families together. And the program, involves leveraging their expertise of primary care clinics, food suppliers, and community partners to ensure children and families have access to affordable and nutritious food for their ultimate well-being. And so the setup would be having a food clinic at the school. It's really, again, going to be catered and modeled to what's fitting for the community, but also we're working with like Hunger Free Colorado as well. And, their goal is, really helping with the SNAP outreach, community organizing, ensuring that the Healthy School Meals for All legislation, so that all students are receiving food, regardless of income status, they're all receiving the food at school. And so, it's really also working in the space of that policy advocacy for that systems change, just again, that sustainability, and the long-term impacts to the community. And so there's programs like that adjust food insecurity. But we also are looking at with other programs such as like Food for Thought is another partner that we work with. And they work to eliminate weekend hunger for children in the Denver area. And so they pack what they call power sacks for kids to use over the weekend, because there are students or there are kids that go all over the weekend. I mean, going 2 days without food, or sometimes even longer. And so, no child should go hungry. And so we have that. And then we also work with Project Angel Heart. They support to prepare and deliver medically tailored meals to people living with severe illnesses. So there's just a kind of a bucket of folks who we work with, again, all doing different types of approaches, working with their community, really, really integrating it into their practice and trying to adapt on how that works. So that's just really the balance, is you got to try it all.
Thanks, Medea. Adam, I know we only have about 4 minutes left, so maybe a couple minutes for Adam, a couple minutes for Joe, and then we'll wrap it up.
Just from a solution design or solution building perspective, I think of things in two buckets. Understand what's worked in the past and not reinvent the wheel, but figure out what parts of that you can take, and then identify what are the biggest barriers that have prevented those things from scaling or say, eliminating the problem, because that's ultimately what we want to be doing, and we should be incentivized to eliminate this problem. And so being able to do enough homework to understand what's come before you, and then not be narrowly minded by what had worked in the past, but taking some of those things as inspiration or starting points, and starting to map out what would have to be true for a solution to ultimately work its way through the system that needs to adopt it and into the hands of everybody who could benefit from it, so that we could eliminate these very preventable problems in our society that are impacting people's health and quality of life. So I like to do enough homework, looking in the rearview mirror, but then try to look at the space with a fresh perspective. And usually, in my team will probably confirm, I always like to talk about what would have to be true for us to go do that, and what's stopping us from putting those things into play, and making sure we've got the right talent, making sure we've got the right resources, making sure we've got the right winning strategy, and then holding ourselves to accountable measure to make sure that we're making progress, and should align incentives across the board for not just us and our members, but ultimately the stakeholders that are enabling us to do this work.
Thanks so much, Adam. And Joe,
Gonna
close us
wrap it
out.
up. Okay. So I will, you asked us to kind of put on our respective hats, and a little bit of that connection with storytelling. I will encourage people who are curious about answers to this question, go listen to the other panels that were recorded and have been made available. Because I'm thinking about Roberto Meza of Hardy Provisions talking about how we need to create and amplify proof points, which is very the sort of help one, help many that connects with us. Thinking of Matthew Chandra of Tukabe, working with indigenous communities, talking about fostering and honoring points of trust, which you've heard us say that's something Adam and I have spent a lot of time thinking about, and recognize if your solution is in a point of trust. I don't care whether you're a brand new, startup seeking your first seed funding, or you're at a multi-billion-dollar organization. If it's not a point of trust, it's not going to work. So I would say that we think about, and I feel like I will be there at the hackathon. By the way, I'm here in Denver. I'm excited for those of you on the call who are going to be there. I will happy to talk more about any of this, but recognize the power of friction. Think about, where are there places where you can slipstream into places where the friction is reduced, or maybe there's a place where too much friction exists, and the solution should be about busting through that point of friction. So to us, how do you do that? You have to see the status quo. And that would what I always encourage. This is what we try to teach people and work with teams to question what's always been done. How do you look at the status quo? How do you build on top of a status quo that actually might serve you? Where are there places where dismantling a status quo is the work to be done? This is the what must be true, but stay aware of the ways also that all of us, and sometimes even the people that you go to who are experts, make sure that as much as you're gaining from their expertise, you're working to recognize where we can be sort of calcified by our experience, our expert perspective, what can and can't be done. And I would, even to kind of bring it back to the future that we're going to be stepping into, where people with this hackathon can pop up ChatGPT and use it as part of the process. Recognize that when you're using data, insights, or AI, use those tools to support you, but recognize that they've been informed by and trained on the status quos that are baked into them. So make sure that you bring kind of like the magic we can bring to the table of recognizing that and being aware of where when you're creating something, you're baking a cake with ingredients that you didn't really consider were being packed in there. Since I'm in a kitchen, we're going to end on a talking about cake. But thank you so much.
Thank you, Joe, and thank you to all our panelists. Really appreciate your insights. I'm gonna hand it over to Sarah.
Thanks. I almost feel like Joe kind of mic dropped by mentioning all the other panels and doing such a great job at quoting aspects of what we were hoping people would learn and draw through all of the panels. So since we are over time, I'll let Joe kind of summarize where we hope you all are. We do have and we'll send out an evaluation for the entire summit series when we send out information with all of the panels posted on our website. This panel will be available to those who have registered. As soon as the recording is available, we'll send that to all of you. Otherwise, I hope you all find space and place to enjoy a meal with friends, family, colleagues over the next several days. I think, Adam, I think you said it, like, how are we not moving in the food is medicine or medicalizing the food space, but what is our food is whatever, food is blank. So find space where food is love for you, and we will see you all soon. Have a great rest of the day.
Everybody.
Bye. Thank you.